Hi, Billy McClean, Head of Community Health and Care Services here for the weekly vlog. This week the inspection activity rumbles on. That Sky you can see in the background, just going off for a walk with her mum. So the inspection rumbles on, and lots of activity around the inspection, but some other really good work going on too. So the locality meetings have now concluded. Yesterday was the last one at Ayr, and although I couldn't make it, the feedback's been really good. So thanks to everyone who's been involved in getting those locality meetings up and running and who's attended them. The other big pieces of work we've been moving on this last couple of weeks has been around our service level plans. So already mentioned the learning disability strategic plan that's now launched, and the mental health one we're going to be working on at the back end of this year and through into next year, and then the adult and older people plan is now complete and was signed off formally yesterday, although it's been really in a live form and being worked on for some time. Formally signed off yesterday. That identifies 13 priority areas, and we've focused on 5 that we're looking to deliver on over the next 6 months. Those 5 will be reported through to the Driving Change meeting that I chair on a quarterly basis, and then through into the Performance and Audit Committee of the IJB. So the 5 areas that we've identified are around the redesign of care at home, the redesign of reablement, the staying ahead of the curve work. So 2 pieces of work there. One is around identifying people in the community through the foot care service that I've mentioned before, and then signposting to community groups and keeping people active for longer. And the other is around the team around the practice, where occupational therapists contact people proactively who've scored moderate on their frailty score, and again look at either signposting or bringing people into that team around the locality. And then last but not least, the participatory budget work, which is really looking at us shifting our spend and our focus to more projects that are led by the community for that community. So delegating some of that decision making closer to each community, so those in Maybole making decisions about what is important for Maybole and commissioning small projects that help achieve those goals with a focus on prevention and early intervention again. So some really good work going on around all of that, and we'll be doing that similar prioritisation work with the learning disability and the mental health plans as well. The other piece of work is around the quality improvement framework. So mentioned that before, that was formally signed off at Directorate Management team yesterday as well, and that is the piece of work where we're trying to support all of our teams across the health and social care partnership, so children's services, adult services, business support and AHPs, to have at least an awareness of quality improvement. And we've got a Learn Pro module that should be going live probably early next year. We've got the module now from NES. We just need to do some technical work to make sure that we can get that on Learn Pro. And the practitioner level training, which is the ACE training that people will have heard of, that's up and running. We've got a cohort going through that just now. We've got 24 people currently on that, and the ambition is that we have 150 by the end of 3 years time, and we're on track to deliver about 70 places this year and 70 places the year after and the year after that. So we should exceed that target, so that's really good to be seeing that moving forward. And then lastly, within that piece of work, we've got the lead level training to support those who are mentoring and coaching to have the skills that they can support all of those people going through that training. So we've got that not quite set up, but we've got some ideas about how we deliver that too, and should have that up and running by next year, so 2023. So some really good progress around all of that work. This week, in terms of thanks, we've got thanks coming through on Care Opinion, so really good to see that we're now getting some positive feedback coming through Care Opinion. And the first bit of feedback is for the Care at Home team, who the husband of a service user who who died, and again was thanking the Care at Home team for going above and beyond in supporting and caring for them through that end of life. So thanks very much to the Care at Home team for all of your work there. And the other thanks really is from me to those who are supporting the inspection work. So a really intense period over the next few weeks. So the social work team leaders in particular, and the working group that's been established. We're meeting twice a week at the moment, and it will only get busier. So thanks very much to all of you for continuing to support that work, and I know that we'll make a good job of it together, so thanks. Any questions, any thoughts, any comments that you want including in the vlog, please do get in touch in the usual way, and I will speak to you next week.